Good afternoon, medical students. Today, we will delve into a detailed exploration of the biochemistry of vitamin E. Vitamin E is a group of fat-soluble compounds with powerful antioxidant properties that play a vital role in maintaining overall health and preventing oxidative damage to cells. It comprises 8 different compounds, the most biologically active being Alphatocopherol. Throughout this script, we will discuss various aspects of vitamin E, including its absorption, transport mechanisms, interactions with enzymes, elimination, cellular defense systems, and therapeutic applications. So, let's begin our journey into the intricate world of vitamin E. The process of vitamin E absorption is highly dependent on the efficiency of mixed micelles. Mixed micelles are aggregates of bile salts, phospholipids, and lipophilic substances such as vitamin E. These micelles form in the small intestine to promote the absorption of dietary lipids. Once formed, the mixed micelles assist in the solubilization of vitamin E in the aqueous environment of the digestive tract, facilitating its uptake by intestinal cells. Inside the enterocytes, vitamin E is reesterified to form vitamin E esters that are then packaged into chylomicrons, which are large lipoprotein particles. Chylomicrons play a crucial role in the transport of lipids, including vitamin E, from the intestine to various tissues via the lymphatic system, eventually reaching the bloodstream. The presence of dietary fat is essential for optimal absorption and transportation of vitamin E, as it enhances the formation of mixed micelles and facilitates its transport through the lymphatic system. Once vitamin E is incorporated into chylomicrons, it undergoes a series of transportation processes within the circulatory system. Chylomicrons are released into the lymphatic vessels, where they eventually enter the bloodstream. Within the blood, chylomicrons interact with lipoprotein lipase, an enzyme found on the endothelial lining of capillaries. This interaction leads to the hydrolysis of triglycerides present in chylomicrons, resulting in the formation of smaller chylomicron remnants. These remnants, known as chylomicron remnants, still contain significant amounts of vitamin E. They are taken up by the liver, where vitamin E is then redistributed to other tissues via the bloodstream. The transportation of vitamin E within the circulatory system involves interactions with lipoproteins, such as very low-density lipoproteins, VLDL, and high-density lipoproteins, HDL. The mechanism of vitamin E transfer between lipoproteins is mediated by a process called lipid exchange, where vitamin E is transferred from lipoprotein to lipoprotein in exchange for other lipids. It is essential to consider the potential interactions between vitamin E and cytochrome P450 enzymes, a group of heme-containing enzymes responsible for the metabolism of various xenobiotics and endogenous compounds in the liver. Studies have demonstrated that vitamin E can affect the activity of certain cytochrome P450 enzymes, either by inducing or inhibiting their function. One of the notable interactions is observed between vitamin E and the cytochrome P450 enzyme CYP3A4, which is involved in the metabolism of many drugs. Vitamin E has been shown to inhibit the activity of CYP3A4, leading to altered drug metabolism and potential drug interactions. These interactions highlight the importance of considering vitamin E supplementation when prescribing medications that are metabolized by cytochrome P450 enzymes to ensure optimal therapeutic outcomes and minimize adverse effects. As a part of its natural metabolism, vitamin E undergoes oxidation, resulting in the formation of oxidized vitamin E metabolites. To eliminate these metabolites from the body, a process called gluconidation takes place. Gluconidation is a phase 2 detoxification pathway in which glucuronic acid is added to the oxidized vitamin E by the enzyme UDP-glucuronosyltransferase, UGT. The conjugated form of oxidized vitamin E is more water-soluble, facilitating its excretion via urine or bile. The elimination of oxidized vitamin E is essential to maintain the balance between antioxidant and pro-oxidant states in the body. Disturbances in this equilibrium can result in oxidative stress, potentially leading to a variety of pathological conditions. Therefore, understanding the process of gluconidation and its role in the elimination of oxidized vitamin E provides insight into the overall antioxidant defense system within the body. During the process of antioxidant defense, vitamin E acts as a chain-breaking antioxidant, preventing the propagation of free radical reactions. However, when vitamin E neutralizes a free radical, it becomes oxidized itself. To regain its antioxidant activity, oxidized vitamin E needs to be recycled back to its reduced form, a process known as redox cycling. Glutathione peroxidase is a crucial enzyme involved in the regeneration of vitamin E. It utilizes reduced glutathione to convert oxidized vitamin E back to its active form. This recycling system allows vitamin E to continue its vital role in protecting cell membranes against oxidative damage. The complex interplay between vitamin E and glutathione peroxidase highlights the interconnected nature of antioxidant defense systems within the body. One of the most intriguing aspects of vitamin E metabolism is the role of the alpha-tocopherol transfer protein, alpha-TTP. Alpha-TTP is responsible for the specific recognition and transport of alpha-tocopherol, the biologically active form of vitamin E. It ensures the preferential transfer of alpha-tocopherol to tissues where it is needed the most, such as the brain and adipose tissue. Mutations in the alpha-tocopherol transfer protein gene can lead to a rare autosomal recessive disorder called familial isolated vitamin E deficiency, FIVD. FIVD is characterized by inadequate delivery of vitamin E to tissues, resulting in neurological manifestations and musculoskeletal abnormalities. Understanding the intricate mechanisms underlying the function of alpha-TTP provides insights into the importance of this protein in maintaining vitamin E homeostasis and preventing deficiency-related disorders. Vitamin E does not act alone in its antioxidant capacity. It collaborates with other antioxidant molecules such as vitamin C and selenium to enhance overall protection against oxidative damage.
Vitamin C, a water-soluble antioxidant, can regenerate vitamin E in its reduced form, allowing vitamin E to continue neutralizing free radicals.
Selenium, on the other hand, is an essential component of glutathione peroxidase, the enzyme responsible for recycling oxidized vitamin E. Therefore, the synergistic effects of vitamin E with vitamin C and selenium create a robust antioxidant network within the body, providing enhanced defense against oxidative stress and preserving cellular integrity. Within cells, vitamin E primarily resides in cell membranes, acting as the first line of defense against lipid peroxidation induced by free radicals. By intercepting lipid radicals, vitamin E protects the integrity and functionality of cell membranes. Moreover, vitamin E's antioxidant activity extends to other compartments, such as LDL particles, mitochondria, and even circulating lipoproteins. The maintenance of adequate vitamin E levels is crucial for optimal antioxidant capacity and cellular protection. Deficiencies in vitamin E can result in increased susceptibility to oxidative damage, leading to various cellular dysfunctions and pathological conditions. Hence, understanding the significance of vitamin E in cellular antioxidant defense systems highlights its indispensable role in maintaining overall cell health and functionality. Neurodegenerative disorders, such as Alzheimer's disease and Parkinson's disease, are characterized by progressive loss of neuronal function and integrity. Increasing evidence suggests that oxidative stress contributes significantly to the development and progression of these disorders. As a potent antioxidant, vitamin E has drawn attention for its potential role in mitigating neurodegeneration. Studies have explored the use of vitamin E supplementation as a potential therapeutic strategy to delay the onset or slow the progression of neurodegenerative disorders. However, the outcomes have been mixed, highlighting the complexity of these disorders and the need for further research to fully understand vitamin E's precise mechanisms of action in the central nervous system. Deficiency of vitamin E can result from inadequate dietary intake, malabsorption disorders, or genetic mutations affecting its metabolism. Clinical manifestations of vitamin E deficiency are primarily seen in systems with high metabolic activity, such as the nervous system, skeletal muscle, and erythrocytes. Neurological symptoms of vitamin E deficiency can range from mild cognitive impairments to severe ataxia and peripheral neuropathy. Muscle weakness and coordination difficulties are also commonly observed. Hemolytic anemia, characterized by the destruction of red blood cells, is another manifestation of severe vitamin E deficiency. Early detection and prompt treatment are essential to prevent irreversible damage and improve the prognosis of vitamin E deficiency. Cardiovascular diseases, including atherosclerosis, hypertension, and myocardial infarction, are associated with oxidative stress and inflammation. Vitamin E's antioxidant properties have led to investigations into its potential therapeutic effects in combating these conditions. Vitamin E has been studied for its ability to inhibit LDL oxidation, reduce platelet aggregation, improve endothelial function, and modulate inflammatory response in the vascular system. However, the clinical outcomes of vitamin E supplementation in cardiovascular diseases have been inconsistent. Further exploration is necessary to determine the precise mechanisms by which vitamin E exerts its effects and to identify patient populations that could benefit from its supplementation. Beyond the cardiovascular system and neurodegenerative disorders, vitamin E has been explored for its potential therapeutic applications in various oxidative stress-related conditions. These include chronic lung diseases, age-related macular degeneration, liver diseases, and certain types of cancer. Vitamin E's ability to neutralize free radicals and modulate oxidative stress pathways makes it an attractive candidate for adjunctive therapy in these conditions. However, careful consideration of individual patient characteristics, dosage, and duration of supplementation is necessary to establish the optimal therapeutic benefits of vitamin E in each specific condition. In conclusion, vitamin E is a complex molecule involved in various processes such as absorption, transport, metabolism, and therapeutic applications. Its antioxidant properties are vital for cell protection and prevention of diseases. However, more research is required to comprehend its intricate interactions with other molecules and its specific mechanisms in different diseases. As future healthcare professionals, it is important to stay informed about vitamin E advancements to ensure optimal patient care and well-being.